cystoscopy first, and here we see a lot of leukoplakia. Our patient is coming from Hungary, and I think she didn't use too much antibiotics until now, and that's why she has these leukoplakias. Now I will look upside down to the bladder neck. Oh, in the left part there is a web of vessels. Yes, I don't know. It's because of inflammation. And here the red patch. Okay, this red part is inflamed part. Here the red part is, there is a border between the red and white tissues. Şu beyaz ve siyah kırmızı sınırı gösteriyor. Yeah, this is a border. And here in this border there is a vessel anomaly, or the neovascularization happened because of the inflammation. It looks really different. And here the red tissue in the 12 o'clock position. In 6 o'clock position, I see too many leukoplakias. I will try to come closer. Yes. I will turn the optic fighting. I am trying to move closer to the leukoplakia, but no, it's not. The optic is not going. Okay, this is enough for me now. Let me make it more focus. Okay, now I can see there's a huge leukoplakia tissues. They are very close to uretary orifice in the right side, and in the left side they are surrounding the uretary orifice. And these vessels, from this view, with rigid endoscope, from up downside up view, it's not very obvious. I cannot differentiate the vascular nature, what's going on here. But the flexible view gives me another angle of looking, and I understand here there is an abnormal vessel formation, abnormal vasculature, and it must be corrected. So we will also fulgurate the abnormal vessels. Now we are marking the borders. This is the important point. Here I can come. We must not forget these guys here. And in our borders, the abnormal vasculature will be treated. Look at these leukoplakias. They are really extreme. Okay, I marked the borders here, and in the right side the tissues are better in the right side, worse in the left side.
Tamam. Sterilizasyon.
Bunu öncelikle istiyorum.
Tamam, cihaz.
Here are the polyps. They are also inside our treatment zone. So they are destroyed like this.
Evet.
Okay, in 12 o'clock position, there was not much tissue, but I can differentiate now. I think this will be the border. And in the right side, I will mark the border. And in the left side, I will mark the border. Now with flexible, we will make control for this. Now I'm checking my marks. Look, at the 12 o'clock position, the mark is not enough. I need, especially in the left side, more further fulguration. I have to deal with this vein too, or vessel. And in the right side, şuradaki işaretleri gösterir misin? Yani these marks işaret yerleri.
Evet.
Bak parmağını yaklaştıracak o şu sağdaki. Heh. This is one of the mark. It seems enough. These marks are enough. In the left side, the mark, but outer side, outer to the mark. Oh, there are more marks here. Okay, they are the trigon marks. So I have to come a little further in all sides. Okay, this is my mark, and in the flexible evaluation I understand that this part also must be treated. So now I am making the fulguration and I will control it with flexible cystoscopy. These are all leukoplakia. Our main deal is these sides. The others are actually details. So the main part is this part. We have to deal with this part very nicely. Sometimes working on details and losing too much time on details will make us less deal with the most important part. Okay, and you see here urethra begins. The fulguration comes just close to here. You see, my border is here. Leukoplakia finishes here, but I want to make a safety border. All abnormal tissues. So at the end we have to fulgurate all red tissues that are inside the borders. This is ureteric orifice. We come very close, we have to stop, but we should do it. The side walls, the upper part is very important, but they are details. First I have to finish these main leukoplakia patches. Our procedure had 80% success rate previously in Turkey, and for the ladies coming from abroad, the success was a little bit less. My main theory about it, their bladders were very, very ill. When I was doing these fulgurations and make a control on their bladder, it was all bleeding. These parts were bleeding, very fragile, mucosal tears were happening. But in the newly coming ladies from abroad, I don't see these defects too much. Maybe people understand more about the nature of the disease and they are now staying a little more away from the use of long-term antibiotics. I am not sure, this is only a theory, but I blame the long-term antibiotics as the most important cause of bladder fragility. Because I believe there is a normal flora of the bladder and it is affected by the use of antibiotics. Look at this, look at this. This is all filled with infection. I feel lucky that this bladder didn't bleed it from other parts. And we had a lot of unhealthy leukoplakia tissues. Again, in my theories, when we make the fulguration, the nature of this tissue changes. Previously, we see the bladder leukoplakia always in the trigon and bladder neck. These parts are not affecting affected. Look, all healthy. Why? The leukoplakia occurred in trigone and bladder neck and nowhere else. I believe they are embryologically different type of tissues. And fortunately, when we fulgurate them, the new coming tissues are very resistant to infection. Why? Because I think they are coming from here, neighboring tissues, side tissues. By the way, look, this is healthy bladder, this is not healthy bladder. I also fulgurate this part. Now it's better. Look at these tissues. They are all fulgurated necrotic parts now. I will wash them out from the bladder. Now we are about to finish. We did all the sides. It's good. And I am controlling the bladder wall thickness in the base of the bladder. And the bladder wall thickness is good. So we make a very superficial fulguration. And this also shows you what's happening during the sexual activity. The bladder moves like here, this way. With simple touch, I can show you this. So that's what's happening during the activity, and it's very disturbing act, and it acts the bladder trigone. Look at these particles floating. I will take them out. I'm controlling for the, okay, like a dust cleaner. I'm evacuating them out. With the backflow of the cystoscope. By the way, I am searching the bladder wall. It didn't bleed. It's a healthy bladder, and this is the best sign for me actually.